Welcome to The Explainer. So today, we're going to look at the human face in a way you've probably never considered before. We aren't just looking at biology here. No, we're looking at an absolute structural, architectural masterpiece. We are literally going to deconstruct the incredibly precise, mathematical process of bilateral complete cleft lip repair and examine how surgeons completely reconstruct the very center of the human face.
But, before we get completely lost in the heavy science, the anatomical diagrams, the geometric grids, I want to start with this really beautiful philosophy: never lose your sense of wonder. Those are the words of the legendary Dr. John B. Mulliken. He was a pioneer in craniofacial surgery and a lifelong mentor to the very surgeons whose work we're exploring today. It really sets the perfect emotional tone for us, reminding us that behind every single clinical calculation, there's just this profound sense of awe for the human body.
Okay, let's dive right into this. How exactly do plastic surgeons use precise mathematical geometry to rebuild a human smile? That is the big question we're answering today. We're going to explore this fascinating intersection where strict structural engineering meets organic biology and art. It's like a giant puzzle.
Section 1. The Foundation, the Mulliken Legacy.
In their 2026 masterclass on the nuances of cleft lip and palate surgery, Dr. Bona S. Lotha and Dr. Temsula Alinger from CIHSR in Nagaland, India, dive deep into this exact intersection. Operating the John B. Mulliken Legacy Centre, their work is all about modernizing Mulliken's original surgical principles. They take us way beneath the skin to the intricate muscle layers. And actually, take a look at the AI-generated facial anatomy right there on the cover. Pretty cool, right?
Section 2, the blueprint, the geometry of repair. To really see the face as a mathematical grid, we've got to define a crucial concept: anthropometric measurement. Basically, this is the scientific study of the measurements and proportions of the human body. Master plastic surgeons aren't just, eyeballing where tissue should go. No way. They use strict anthropometric data to create a literal calculated blueprint for the repair.
Check out this hand-drawn sketch of the inner palate and the dental arch. If you look on the right side, you can clearly see these distinct quadrants marked 1, 2, 3, and 4, all intersecting at strict right angles. These lines, they are the underlying framework. They provide the architectural pillars for the surgeon's work. It ensures the whole foundation of the jaw is perfectly aligned before anyone even touches the visible exterior facial features.
Section 3. Navigating anatomical landmarks.
Now, what's really interesting about this slide is how meticulously the soft tissues are charted out with specific numerical measurements. You can see the 3 sitting right above the central area and the 4.7 right below it along that curviconcave line. These specific points map out the exact distances needed to reconstruct the philtrum. That's the little vertical groove above your upper lip, and the columella, the bridge of tissue separating your nostrils. I mean, literally, every single millimeter counts here.
Let's break down this surgical map legend. The prolabium, that's the central, lower portion of the upper lip structure. Then, moving upward toward the nose, the soft triangle zone sits right near the rim of the nostrils. And out to the lateral sides, marked by the endpoints, is the myrtiformis zone. Knowing exactly where these zones sit is absolutely crucial. They act as the anchor reference points a surgeon uses to piece separated tissue back together flawlessly.
And all of these intricate measurements tie directly back to Dr. John Mulliken's landmark 1985 paper on bilateral complete cleft lip. His principles established a really clear procedural flow. Step 1, you map the geometry using those strict anthropometric points. Step 2, you align the orbicularis oris. That's the crucial, complex circular muscle around the mouth that controls speaking and eating. And step 3, construct Cupid's bow, that distinct, beautiful double curve of the upper lip. These 3 steps build on each other sequentially to restore both dynamic muscle function and natural aesthetic form.
Section 4. The Masterclass Approach, Deconstructing the Blueprint.
And this comparison brilliantly illustrates the duality of this complex surgery. On the left, you've got the hard, quadrant-based math of the palate: rigid angles, straight lines, strict coordinates. But over on the right, you see the sweeping, organic curves of the lip and nasal repair, the curvy, concave shapes, the soft triangle zones. The surgeon has to flawlessly bridge these 2 completely different worlds: the rigid internal scaffolding and the soft, expressive exterior.
Section 5. The Final Masterpiece, Crafting Happy Smiles.
After looking at all this cold, hard, clinical terminology, we have to ask, why do these precise coordinates actually matter? Well, they matter because the ultimate goal is translating that unforgiving math into the organic warmth of a child's natural smile. If you look just below the Legacy Center's name on the masterclass cover, it says Happy Smiles. That's what it's all about. The meticulous science, mapping the orbicularis oris, plotting Cupid's bow, it's all in service of giving a child their full, expressive smile.
Looking to the future, you might have noticed a little badge on the 2026 textbook cover that says Using AI Imagery. It leaves us with a pretty provocative thought. As we move forward, how will artificial intelligence redefine the exact science of anthrometric mapping? If Dr. Mulliken's 1985 principles gave us the geometric foundation, maybe AI will help the next generation of surgeons execute these masterpiece repairs with unimaginable precision. It's a thrilling frontier for human healing. Thanks for joining me on this explainer, and remember, never lose your sense of wonder.